Hey there, Medicare Joe here again, and this is part of our Medicare Basics series. We're going to be diving into what is Medicare Part B, and this is usually the one that stumps everybody. They think Medicare is free until they hear about Part B. So we're going to actually go over what Part B covers, what the costs are, and what can really be the biggest mistakes when someone's actually signing up for a Part B of Medicare. So to dive into the content here in our Medicare Basics series, what is Medicare Part B? So I talked about this in a prior video, but I summarize Medicare Part B as the everything else category. So if we think about Medicare Part A from our last video talking about inpatient hospital care when you're admitted into the hospital, Part B is everything outside of that. So think doctor visits, primary care specialists, think outpatient care through surgeries, urgent care, surgery, outpatient lab work, tests, imaging, everything that you can think of that's not an inpatient stay in the hospital is probably under Part B, which is why I say the everything else category. On your card, this will say Part B is your medical insurance. So specifically what Part B doesn't cover is dental, vision, hearing coverage, long-term care coverage, prescription drugs. Again, that's going to be under Part D, which we'll talk about in our next video. And then most routine like cosmetic surgeries, foot care, stuff like that. Now, this is again where everyone gets stumped with Part B. A lot of people come to us thinking Medicare is completely free. Part A is completely free if you've worked 40 quarters or at least 10 years, you or your spouse. Part B always has a premium associated with it when you're aging into Medicare. And in 2025, the Part B premium is $185 a month. And if you are a higher income earner, there is what's called a IRMA adjustment, an income-related monthly Medicare adjustment, which I will link in the description below, the chart, so you can see if your income is above $106,000 individually or $212,000 filing jointly, incrementally that Part B premium of $185 is going to be more for you every month, depending on the bracket you fall in. And even if you go with the Medicare Advantage plan, you're still going to have to pay your Part B premium. And for some folks, that Part B premium, if you're receiving Social Security, comes right out of your Social Security check before you get your distribution. If you're not receiving Social Security, what they do is they bill you quarterly for the amount until you start to receive Social Security, and then it comes out automatically. And this aligns with the Part A enrollment. You're going to sign up for this 3 months before your effective birth month of turning 65. And again, if you're planning to start Medicare, if you're planning to delay Medicare or hold off if you're still working, you don't have to start this. But if you're getting onto Medicare at 65, 3 months before is when the enrollment process starts for that. So again, Part A has a cost on the premium side, monthly premium side of things, but it also has a cost internally similar to Part A. So with Part B, you have an annual deductible. So this is a yearly deductible of $257. Basically what that means is if you have any type of services done outside the hospital, you're paying the first $257 for those services to be covered. Now, after you've met that deductible of $257, the plan then turns into what's called an 80-20 cost share. So Medicare Part B pays 80% of your bills, and you pay 20% of the balance. And there's no cap to that. There's no out-of-pocket maximum at all. And this is why, again, if people go with Part A and Part B of Medicare, the original Medicare option, they are adding a Medicare supplement plan, because the Medicare supplement plan is going to cover all of these costs that you're hearing about on Part A and on Part B and give you 100% coverage, so there's no gaps in coverage. So again, the most common thing with Part B is you have that $257 deductible and then the 20% coinsurance that you have to cover, which is why a Medicare supplement plan makes sense for people going that route. Now, some common mistakes I want to touch on. Part B is the one that you have to pay for. So again, it really depends on if you're going to need to start Medicare at 65, if you are going to be starting Part B. So if you are delaying your Part B coverage because you have creditable coverage through your job or through a spouse's employment, right? You can actually delay your Part B and start that when you or your spouse retires and comes off of that job coverage, that creditable job coverage. Now, if you don't have creditable coverage and you don't sign up for Part B when you turn 65, this is where the high penalties come into play. You have a 10% per year penalty for every year you forego signing up for Part B and not have creditable coverage in its place. So if you have 3 years without creditable coverage and you delayed your Part B, you're now paying 30% more lifetime penalty for on top of whatever the Part B premium is at that point. So if it's $185, you'd be paying 30% more than that every single month. So again, these penalties can get really costly if you're not doing it in the right order and if you're missing enrollment deadlines. I generally tell all of my clients to talk with their HR and confirm that the coverage they have through their work is considered creditable in the place of starting Medicare. We also hear a lot of folks that come to us and say, like, I have never had coverage, or I've been uninsured for 5-10 years, believe it or not. And if that's you, this is important to understand that if you don't sign up at 65 and you plan to forego it when you do start later on in life, as you may get less and less healthy and need health care, at that point, those penalties are going to be in place there as well. So with Part B, it's not just about knowing that Medicare is not free. There is a cost associated with it. It comes from the Part B side of things. That's where the cost comes into play monthly. There's exposures to it, the deductible, the coinsurance, which is why you have the need to add a Medicare supplement plan there. And this is the biggest one when it comes to you hearing about late enrollment penalties. It's around the Part B. It's making sure you do this part right, because this is the most costly part. This is the most costly mistake that people can have when getting onto Medicare, is not doing the Part B right. If you liked this video or found this to be of any value to you, hit that like button below. And again, if you are turning 65 or if you're helping somebody through this, you have questions, comments, please drop them in the comment section below. I personally go through those and answer them. Would love to give you some insight on anything that you're stuck on. And if you'd like to be notified as we post new YouTube videos to our channel, hit that red subscribe button and that'll notify you as we post new Medicare videos here to our channel. Thanks for watching today's Medicare Basics series.